Healthcare providers have been actively engaged in the FASB and ISB joint project on revenue recognition, as the industry could experience significant changes. The final standard was issued in May 2014. This podcast will provide you with a high-level summary of the new revenue standard and some impacts the standard will have on healthcare providers. My name is Lauren Thomas, and with me today is Jared Silver, and we're both on the revenue project team in DPP. Jared is going to provide some insights into how the new standard will affect companies in the healthcare industry. Jared, can you start by giving an overview of the standard?
Sure, thank you, Lauren. The core principle of the new revenue standard is that an entity recognizes revenue to depict the transfer of promised goods or services to customers in an amount that reflects the consideration to which the entity expects to be entitled in exchange for those goods or services. The standard establishes a 5-step model for implementing the core principle. Step 1 is identifying the contract with the customer. Step 2, identify performance obligations in the contract. Step 3, determine the transaction price. Step 4, allocate the transaction price to performance obligations. And Step 5, recognize revenue when or as an entity satisfies a performance obligation.
Thanks, Jared. Let's move on to talk about some of the potential impacts to healthcare providers. Currently, healthcare providers record patient service revenue and related bad debt when services are rendered, even though they do not expect the patient to pay the full amount. Will this change under the new standard?
Yes, Lauren. The new standard includes a collectibility threshold requiring the entity to conclude it is probable they will collect the consideration in the contract. The assessment includes considering ability and intention to pay specified amounts. The collectibility assessment is based on the amount of consideration to which healthcare providers expect to be entitled after contractual allowances and any implicit price concessions. The new standard also includes an example of an implicit price concession. A healthcare provider must evaluate if it expects to accept a lower amount of consideration than what was billed for a patient class. For example, uninsured or self-pay patients. If the healthcare provider expects a lower amount of consideration for the services provided, the promised consideration is variable, and the provider estimates the transaction price based on historical collections for that patient class. If the healthcare provider can conclude it is probable, it will collect the estimate of variable consideration after the implicit price concession. The contract has met the requirements of Step 1 and will be accounted for under the new model. It is important to note the new revenue standard is applied on an individual contract basis, although there is a practical expedient that allows the use of a portfolio approach if the outcome would not differ materially from applying to the individual contract. When applying a portfolio approach, healthcare providers will need to consider which patients have similar characteristics.
Thanks, Jared. Under the new standard, how would you account for consideration received by a healthcare provider in a transaction that does not pass Step 1 of the model?
Under the new standard, there will be cases where healthcare providers may determine that they do not have contracts with patients because they do not pass Step 1 of the model. If consideration is received prior to concluding a contract exists, an entity would recognize revenue when 1. The entity has no remaining obligations to transfer the goods or services to the customer, and all, or substantially all, of the consideration promised by the customer has been received and is non-refundable, or, 2. The contract has been terminated and consideration received from the customer is non-refundable. Until those conditions are met, or the healthcare provider determines that the contract passes the collectibility threshold, it records consideration received as a contract liability.
Thanks, Jared. Before we move on, I want to highlight one further point. Further implementation guidance might be needed to explain when the deposit liability will be recognized in income. Let's move on to talk about our next topic now, presentation of bad debts. Jared, can you tell us how this will change under the new standard?
Absolutely. Presentation of bad debts. Currently, U.S. GAAP requires some healthcare providers to present bad debts as a reduction from patient service revenue. Under the new standard, bad debts will be presented as an operating expense. One item to note, if an implicit price concession is reflected in the transaction price, the amount of bad debt may be significantly less than what would be recognized under current GAAP. The final issue I would like to highlight today is variable consideration in reference to revenue earned under arrangements with government programs, such as Medicare or Medicaid, subject to retrospective adjustment. Currently, healthcare providers determine their best estimate of third-party settlement adjustments based on their experience. Under the new standard, providers will use either a probability-weighted assessment or best estimate, depending on which better predicts the amount the entity expects to be entitled.
Jared, is the variable consideration under government programs subject to the constraint on variable consideration?
Yes, it is. Healthcare providers need to conclude it is probable that the estimated variable consideration will not have a significant risk of revenue reversal.
Thanks, Jared. Let's wrap up today with discussing the effective date, disclosures, and transition approaches. Can you start by telling us what will be the effective date for healthcare providers?
Certainly. The effective date for public business entities and not-for-profit entities that issue conduit debt or are conduit bond obligors, like many healthcare providers do, will be for the period beginning after December 15th, 2016, so starting January 1st, 2017 for a calendar year-end company. Under U.S. GAAP, early adoption is not permitted. All other entities, for example, a not-for-profit healthcare provider that does not have a conduit debt, will have a 1-year deferral for annual periods to 2018 for calendar year-end companies and a 2-year deferral for interim periods. These entities, however, are permitted to adopt in 2017 at the same time as healthcare providers that do have conduit debt.
Thanks, Jared. Can you touch briefly on the disclosure requirements?
Sure, Lauren. Disclosures are going to expand significantly. There are quantitative disclosures that will be required. For example, a disaggregation of revenue, as well as qualitative disclosures on the significant judgments made in applying the new standard. For example, how the transaction price was determined. Not-for-profit healthcare providers that do not have conduit debt get relief on a number of the disclosures. As companies think about their systems, processes, and controls, they should also be thinking about the data necessary to meet the disclosure requirements. In transitioning to the new standard, entities can select from 3 transition approaches. A full retrospective approach could be used. Under this approach, an entity would recast all contracts for all prior periods presented. A retrospective approach can also be done using one or more practical expedients. An example of this would an entity not have to recast contracts that began and ended in the same annual period. A third approach is the cumulative effect at date of adoption. Under this approach, an entity will record a cumulative effect adjustment at the beginning of the year under this option. In addition, under this approach, an entity would be required to account for revenue transactions, both under the new standard and legacy GAAP, in the year of adoption to determine the effect of the accounting change, and provide disclosure in the period of adoption of the impact of the change on each financial statement line item.
Thank you, Jared, and thank you, the listener, for joining our podcast today. For additional information, refer to KPMG's Financial Reporting Network, including the latest on revenue recognition page, which links to KPMG's analysis of the new standard, including defining issues, executive accounting updates, including industry supplements, and webcasts and other podcasts.